So you have symptoms that could be related to fibroids, and your doctor says, let's look for fibroids. How would they do that? We use imaging, we use exams, and sometimes we use procedures. So number one, a pelvic exam can actually help you feel the contour or the shape of the uterus and the size of the uterus. Your uterus should be about the size of my fist. Anything much larger, you may have fibroids or you may have some other type of conditions. So one way is the pelvic exam. The most common way to actually detect fibroids is a pelvic ultrasound. The pelvic ultrasound can be a little awkward. It doesn't hurt, but it can definitely be awkward. So we put that gel on your belly and then scan. But we also may put a gel probe through the vagina. That helps us actually look at the ovaries much better. So it usually is a part of the order that your doctor will look at. But those two views of the ultrasound can really determine most fibroids. Notice I said most fibroids, not all. Fibroids can easily be missed. So you might come back with an ultrasound report saying you have 3 fibroids and then have some type of surgical procedure and your doctor finds 5 or 6 or 7. So ultrasounds are really good tools. They're inexpensive tools. Insurance companies generally will cover them. They're really good ways of diagnosing fibroids, but they can miss fibroids as well. Now, another way we diagnose fibroids or actually add to our diagnosis is MRI. MRIs are really good tools as well. Some people feel nervous because MRIs are often closed. There are a few MRI machines and institutions that have an open MRI for people who are afraid of claustrophobia. But MRIs are really good tools for helping us with the actual location and size. They do not cause problems with radiation. The problem with MRIs is they can be quite expensive, and insurance companies are very reluctant to cover MRIs. However, when a patient needs MRI for mapping, such as in one of the uterine sparing procedures like the Accessa or the Sonata, which really is radiofrequency ablation procedures, or in the uterine fibroid embolization procedures, it can be very helpful for the surgeon or the procedurist to understand where those fibroids are. So that's a time where we tend to use the MRI if a patient is going to have a procedure like that. The other thing that we can do is something called a hysteroscopy. A hysteroscopy is when we go in through the vagina, we fill up the uterus with water, just like it's a water balloon, and we look with a camera. So hysteroscopies are done either in the office with no sedation. I have some really tough patients and they're fine. Sometimes we give them laughing gas. Sometimes we do light sedation. And some patients say, doctor, you're not touching me with a 10-foot pole until you knock me out. And that's okay too. So we can do it with all different types of anesthesia or no anesthesia. But the cool thing is it takes about 10 minutes. It gives me a lot of information about the inside part of the uterus. Remember our model of how the uterus is inside, middle, and outside? I'll show you a model again. But anyway, the hysteroscopy allows us to look inside the uterus to look at fibroids that might be in the canal or in the internal part of the uterus. And let's see. Yep, that's how we diagnose fibroids.